With me this morning is Dr. Melanie Mouzoon from Kelsey Seybold. Thanks for joining us, Dr.
My
Mouzoon.
pleasure.
So starting with pediatrics, babies get vaccinations very young. What are they getting and why is it so important?
So the first vaccination that we offer babies is the hepatitis B vaccine at birth, and that protects them actually against developing cancer as young adults, because hepatitis B early infections cause chronic infections. And so we start that. Every vaccine is actually given at the youngest age at which it is both safe and effective. And the reason for that is you never know when you're going to be exposed to an infectious disease. So if the vaccine's safe and effective at that given age, then babies get it. Most vaccines for children, though, start at the 2-month checkup.
2 months, I mean, in the hospital you get some at 2 months, some are at 6 months. I feel like I was mentioning, as a mom of a 2- and a 3-year-old, I feel like every visit somebody's getting a vaccination for something. And it can be a little bit challenging to know what they need and know what they're up to date on. So sometimes you might miss a dose.
Well, and many children got behind during the pandemic, and because they missed coming in for well-child checkups out of fear of catching the illness, So a lot of children are behind, and that's particularly concerning about the measles vaccine, because measles is highly contagious, even more contagious than COVID, really.
And we still see it around our community every once in a while.
It flies in from other countries, and people here who are unvaccinated tend to be in pockets. Either they're in low-resource communities without access to vaccination, or there are people who have declined vaccination. And so if measles comes into our community, those people who have not been vaccinated are at very high risk.
Yeah, they're really at risk. So if somebody has missed a dose, what can they do?
So you can catch up on vaccinations at any visit. We used to think, you had to restart series. That's not the case.
I did think that.
So we really, you can catch up at any visit. And so most doctors try to assess your immunization status every time you come in, but you can't give shots to people who are not in the office. So telehealth is not the way to go.
As much as we do love it.
Right. So if you haven't had an in-person visit with your physician in a while, be sure to ask about your vaccines at that visit, and most physicians' offices should be reaching out to patients who are behind, but they don't all have the resources to do that. So
well, and it's challenging for parents too. As somebody who works Monday through Friday, a lot of Saturday clinics don't offer the vaccines on Saturday, so you have to make time to do this, and that can be a challenge for families as well.
Right, and do remember that pharmacies give vaccines too. So if you have adolescents that need vaccines, they could get them at a pharmacy on the weekend as well. Although it's not as good as having a checkup and really having other issues addressed. Everyone has health issues that need to be addressed, and a physical exam is important. So regular scheduled visits are important, but you can get vaccines at an ear infection visit, or really any visit.
Okay, and what age do the vaccinations stop for kids? When can I finally relax on giving my kids the vaccine?
So the first year of life, it's every 2 months for the first 6 months, and then every 3 months for a while. And you're right, it feels like a lot, but after the age of about 18 months, vaccines stop until age 4 if you're caught up. If you're not caught up, then when you go in at your two-year-old checkup, you're going to get a shot that you should have gotten at 18 months, for example. And so they're really done at 18 months, and then there's a 4-year-old checkup, and then there's the preteen checkup. So starting around age 9 to 11 or 12.
Okay, we're coming up to the 4-year-old one, so then I have a little bit of a gap until preteen years. Good to know.
As long as you stay up to date.
What about adults?
So there have been some changes in adult immunization, and really one of the big changes is that all adults are recommended to get hepatitis B vaccine up until the age of 60. That's because really there are a lot of adults who become diabetic, and diabetics have to poke their themselves for blood testing a lot, and there have been outbreaks of hepatitis B. And also because of more fatty liver disease, and so people who have obesity or fatty liver disease are at higher risk from hepatitis.
And they don't have that protection from childhood, or they didn't get a vaccine in childhood?
So we've been giving the hepatitis B vaccine ever since 1992. My 30-year-old got it as a newborn, and so we've been giving it for quite a long time. So people up to age 30 are pretty much immunized if they went to a physician who was keeping them up to date. And then people between 30 and 60 need to see if they've had their hepatitis B vaccination series. And there are new pneumonia vaccines out for adults as well. And of course, we all need our COVID vaccines if we haven't had them.
COVID, flu, those are ones that we keep telling adults to get. Interesting that a pneumonia vaccine is, there's a new one. Is it more effective?
It covers more strains, and so there are actually two new ones. One covers 15 strains and one covers 20 strains, and basically before you had to get 2 different shots to get up to in the 20s, and so there's some kind of complicated recommendations depending on what you've had in the past, but most adults need to update themselves on their pneumonia vaccines, particularly if they're over age 65, but even those who are age 19 to 64 who have any kind of chronic health issue.
Okay. What about shingles? What age can you get shingles?
So you can get shingles vaccine all the way down to age 19 now, particularly if you have a history of having had shingles. It's generally recommended for age 50 up if people haven't had shingles, but we can now give it, you know, in particular circumstances if people have had recurrent cases of shingles.
That's good, because I feel like that's one of those things that we kept, you know, you don't get the vaccine until, it used to not be until 50, but you kept hearing cases of people getting shingles younger, and it's a really unfortunate virus to get. So thank you so much, Dr. Melanie Mouzoon. Those are all fabulous tips, so I appreciate you joining me for this live interview.